Welcome to Adapted Class. The NCLEX doesn't care how many hours you studied. If you cannot think like a nurse, then there's a problem. Let me show you how to pass this test by doing what smart nurses do every day, using common sense and a buzzword. This is video number 3 to help you answer questions in a common sense way, tough ones. Even if you don't know the content or you know a little bit about it, stick around. 10 questions, I yield, I charging information for you. Let's get to it. First question. You look at this and you defeat it. You completely defeated because you said, what is this? It's EKG. I don't know EKG. You know EKG. You can answer it. Relax. Use the buzzword. Stick with it. Answer the question the board is asking you. This is the question. What is the question asking? What action should the nurse take first? I know you can take an action. Therefore, take an action. That's what the question is asking you. What is the problem? A nurse enters the room of a client and observes the following rhythm on the cardiac monitor. You saw this. The client is found sitting in the bed and reading a magazine. There is a reason why after I give you the EKG, I give you additional information for you to follow or pay attention to. Sitting in bed and reading a magazine. But this is the rhythm you found. Look, this is telling you that the patient is what? Think about it. What would you want to do? Prescribe what? Administer the prescribed atropine 0.5 milligram IV immediately. Apply transcutaneous pacing device on the client. Ask the client how they are feeling. Administer prescribed metoprolol IV push. I give you 10 seconds. Answer the question, pause the video, and then answer the question, and then come back and listen to what I'm going to say. 10 seconds is up. What would you pick if you are in this situation? Look at it. At least you should know that this rhythm is very slow. It's the slowest rhythm you're going to see. If you calculate the rate, it's very low, like in the 40s or 50s, right? This is a bradycardia. And therefore, what do you want to do? Bring the heart rate up. Do you give this patient atropine? Do you try to do transcutaneous spacing? Or ask the client how they are feeling or give the patient metoprolol. But look at it. The guy is reading in bed and reading magazine. That means he's asymptomatic. He's fine. That is what his heart rate maybe is relaxed, is chilling like he's in Florida. Atropine, you got to bring a little bit of content. Thinking like a nurse. He's reading in bed. Atropine is designed for what? Symptomatic bradycardia. Patient has no symptoms. It's gone. If atropine fail, I know I'm supposed to give him transcutaneous pacemaker. If your heart rate is already slow, metoprolol is going to decrease your heart rate. I don't know what 3 is saying, but I'm going to pick it just by common sense. It's just asking for the symptoms. Ask the patient how they're feeling. Is asymptomatic, therefore, they let the doctor know later on that a patient is bradycardic, but he has no symptoms. But atropine is designed for symptomatic bradycardia. Answer questions in the common sense way. I hope you get it. All the answers to choices or the questions is going to be like that. So I expect you to get engaged, answer the question, and then see the way I'm going to approach it. Pause the video, but think like a nurse. Think like a nurse in the common sense way. Which action should the nurse take first? Do something. A nurse is caring for a client on the cardiac unit, the same thing. The telemetry monitor shows a heart rate of 34. Another bradycardia question. What would you do? That's all. Call the doctor, check the tele leads, prepare for pacemaker, or give the patient oxygen. Patient is in the cardiac unit. He has a rate of 32 beats per minute. And this was fine on the telemetry unit. What would you do? Pause the video, answer the question on your own, and see the way I'm going to approach it. Do you trust the rhythm? You got to do your assessment. Why is my patient has the heart rate of 32? Calling the doctor will not give you that idea. He'll ask you, how is the patient doing? Checking the lead to confirm is a good idea. Pacemaker, you don't even know if the patient has symptoms. Why would you have to do temporary pacing? Oxygen. How does oxygen has anything to do with the patient's bradycardia? Is he having PEA, pulseless electrical activity? I don't know. But because oxygen is always a trap, everybody say oxygen is the good thing. Guess what? It's a poison. When you see oxygen, think about it like any other poison. You don't use it all the time if it's not indicated. People have other problem. If they don't need oxygen, don't give it to them. Common sense. I check the lead, assess the patient, let the doctor know, and figure it out. So 2 is the right answer. You see the common theme. All of them are like that. This is another example. Which item in the operating room should the nurse remove? A client with the latest allergy is scheduled for surgery. Oh, he has latest allergy. That's the buzzword. And he's scheduled for surgery. Therefore, I should remove all latex. Latex, I know most of the time we find it in rubber item, plastics, right? Rubber. Stainless steel is not plastic or rubber. Vinyl gloves, of course, it's a rubber, but this is what? Non-latex agent. This is what we use. Vinyl gloves is when we use, it has no latex in it. I see the rubber tourniquet. I don't know what it is. Alcohol, it's not rubber. You see, answers is screaming at you. Latex, surgery, what do you remove? Common sense will tell you, rubber meets rubber. I'm picking it. And you know the answer. I want you to do that every question you see. Every question. A nurse is teaching a parent how to prevent sudden infant death syndrome. I have no clue what SIDS is. Which statement indicates a need for further teaching? That means I'm saying something bad. Look at it and see if mommy is trying to rationalize something or is trying to say something that is partially true. When you see that, that is the way to answer this kind of question. But what is that? SID, what? S. Sudden. That means it happened all of a sudden. I don't know. Infant. It has to be a baby. Death. Okay. Syndrome. Collection of things. Maybe it's not only one thing that causes it, but there's something associated with it. And I look at the answers and say, I will place the baby on their back to sleep. That means something related to sleep. If the baby back is on the bed, that means the airway is protected. Oh, I don't think this will cause sudden infant syndrome. I will keep stuffed animals out of the crib. Sudden, sleeping, stuffed animal. Is it going to like suffocate the baby? Maybe. The baby can nap on their stomach. Oh, this is contradicting the first one. Now the baby is prone. If I am watching, I think it's a trap. I will use a firm mattress without pillows. You see, no pillow is equivalent to the stuffed animal out of the crib. And stuffed and firm mattress probably prevent the baby from moving and preventing suffocation. You can see, like, one of them is the problem. The baby taking nap on the face. That is the only one saying baby is prone. All of them is either they on their back or they were supported. test-taking strategy using buzzwords and common sense. Thinking like a nurse. I know 3 is a trap. I'm not picking it. A client with diabetes is found wandering the hallway, like looking pale and diaphoretic. What is the next action? Go with the buzzword and common sense. Look, I have diabetic. The only thing you know about them is they're either hypoglycemic or they go into symptoms of decay, hyperglycemia. He's wondering, why would he be wondering? I did not tell you the patient has what? Dementia. Something is wrong. And he's looking pale. And he's sweaty. These 3 things doesn't make sense. Wandering, looking pale, and diaphoretic. What is the next first action? The only thing I worry about is he hypoglycemia or hyperglycemia. So what would I do? Assist the client back to the bed. Okay. Check the client blood glucose, call the provider, and give the client orange juice. If you are the nurse, what would you do? Thinking like a nurse. Come on, man. What would you do? Assisting the client back to bed, it does not address the diaphoresis and looking pale. He's wandering around. Do you think he will be able to go? Think he's confused. He look pale, diaphoretic. It may be hypoglycemia. Checking the blood glucose. You already have symptoms. Diabetic, diaphoresis, looking pale and confused. I already know the patient has symptoms. Checking blood glucose is not going to happen. I have evidence of that. Calling the doctor. Hey, you ask you, how is the patient doing? You already know. Can you fix something before you call the doctor? Give the patient orange juice. I know a lot of people will check the glucose, but you have all that you need. Patients confused, looking pale, and diaphoretic. If they have symptoms, you fix it before you look for value. Symptoms, treat it before you do some testing. That's all. Patient is dying. Take care of it. Number 6, a nurse is teaching a client by using the cane. Which statement indicate incorrect understanding? This is one of the things that you see all the time, fundamentals. Look, it's so easy if you think about it in a common sense way. I have a cane. I will hold the cane on my weaker side. Well, the cane is not supposed to support the weaker side. It's supposed to support your stronger side, because if you use it on the weaker side, you got to lean on it. And because your weaker side is weak, you're going to fall down. I will move my cane at the same time as my stronger leg. Once again, it's supposed to support your stronger side, but if you move it at the same time, you make the left side more weaker. I will place the cane 6 to 8 inches in front of me before I step. Maybe that may be true. I will use the cane to support myself if I go upstairs, stepping first with my bad leg. You probably may already know. It's an acronym, right? You already know. Up with the good leg and down with the bad leg. It's not doing that. Therefore, which indicate understanding. The only thing I know about, I don't know what 6 and 10 inches is. I have no clue whether it's true. But I know 1 is going to fall down, 2 is going to fall down, and 4 is going to fall down. Therefore, I'm going to pick 3. I don't know if 6 to 10 inches is true or not, but it's better than the rest. During a home visit, a nurse observes that school-age twins are arguing over toys and frequently talking about each other. They're arguing about toys and talking over each other. What is the most appropriate way for the nurse to document this? Twins, school age, fighting over toy? Why would the NCLEX ask me? Because they want to trap you. Twins are showing signs of aggression. I don't see any aggression in between them. Twins are showing signs of development. Are they developmental delay? Twins are displaying age-appropriate social interaction. I don't see that. Twins are what? Counseling due to need counseling due to inability to share or listen to the others. I don't know. But think about it. Go back. School age. They are twins. They're playing with toy. If you have kids of the school age, what do you think they will do with toy? They're going to fight. They're going to do it. And therefore, what do you think? There's no aggression. These are not aggression. It's appropriate way for these kids to behave. There's no evidence of developmental delay just because they're fighting over toys, right? Age appropriate social interaction. That's what they do. There's nothing telling me that one is not having the idea to share, right? It sounds good. A lot of people will pick four, but look, this is an appropriate behavior. Let's thinking about it and answering the question. And next is assessing a home safety practice of a mother with a 1-year-old. Which statement by the mother indicates correct understanding? Look at the answers, stop the video, pick it, and then let's go over it. Think about it. My baby slept with a small stuffed animal for comfort. Think about it. I'll give soft food like banana and cut grapes into halves. You can see 1 and 2 are related. Something related to something going on with the baby. We give them something that they're not supposed to. Stuffed animal, cutting banana and grapes into half. But 3 said balloon and plastic should be out of reach. That means something about suffocation is not appropriate in between these 3 questions. Toys with small part are okay. Same thing. 4 is emphasizing that small toys with small part that can break, that the kid would take and swallow and they get into trouble. Therefore, stuffed animals are not good. Banana and even grapes shouldn't be cut into 4, not 2. And then small toys with different parts are not good. No matter how small they are, even if you supervise them, they can swallow it. 3 is the best answer. 1-year-old child who attend daycare is recovering from episode of otitis media, ear infection. Which intervention is the most important for the nurse to recommend to the parents to help prevent recurrence? Question is asking you, I have ear infection. How can I prevent a future one? Preventing water from entering the client's ear. That may prevent future infection. Limit your child juice intake to once daily. What do you think? When your child off pacifier, what do you think? Extra snacks between meal to boost immunity. What do you think? Once again, stop the video, listen to the way I approach it, and let me know what you think. I've never heard about snack improving immunity. Your immune system is not cannot be improved with snack. It's the trap. It use boost immunity, but then it's an extra snack. Snack are not designed to do that. I'm going to eliminate that. You think otitis media is due to ear water entering into the ear because that's the most common thing everybody think about. It's not due to that. The most common one is smoking, kids using pacifier, or drinking in the cup or in the bottle while they sleep. The pacifier changed the pressure in the ear. The ear is connected to the back of the throat in kids, a very short eustachian tube, and the pressure changes causes the otitis media or fluid as they sleeping and they drinking. It goes into the ear and causes the problem. So the best way to prevent recurrent is no pacifier. Stop smoking and don't give the kid what bottle drinking while they are asleep. 3 is the right answer. And the last one, a nurse has attended staff education program about cannabis use. Which of the following statement by the nurse will require follow-up? Which one will require follow-up? I don't know what is asking me, but at least I've heard somewhere that cannabis is a stimulant, right? Therefore, I know stimulant, if I give you stimulant, your symptoms is supposed to go up. That is what I know based on my test-taking strategy and common sense. Regular cannabis use may affect memory and learning, especially in teens. I have no clue. I don't know. Cannabis use decreases heart rate. I have to think about it carefully. Cannabis use can increase blood pressure. Well, I got to think about it. Cannabis withdrawal causes sleep disturbances. I have no clue. But at least common sense, I said, Why would they tell me cannabis decreases heart rate? Anything decrease heart rate should not increase my blood pressure. That is the thing. One would decrease my heart rate and then one would increase my blood pressure. But I know it's a stimulant. Therefore, increasing blood pressure is good. I don't know what is A or four, one or four is, but since one is increasing my blood pressure, I know that decreasing my blood pressure is wrong. So I'm going to pick it by common sense. And that is the right answer. As I've said, you got to think like a nurse. It's not the number of time you study, but being smart when you select answers. I always call it, you got to be sharp, pay attention to the buzzword, and bring the little content you know. At least something about cannabis will have helped you answer this question. There's one or two information that you know is a stimulant. This is now video number 3. I hope this helps you as you navigate all these questions and be able to break down these questions and answer them in the very common sense way. You got it? Go get it. Take care of yourself. If you like it, subscribe to Adapt English. And good luck and get more video like this. 2 more and we'll finish with this series. All the best of luck. Bye.